It is an viral infection of the bronchioles. It is a viral infection of the bronchioles, and it is characterized by cough, respiratory distress, and wheeze. Cough, respiratory distress, and wheeze that start following an episode of respiratory tract catarrh. Clinical features of bronchiolitis. Clinical features, symptoms, important. খুবই ছোটো ছোটো sudden onset of symptom signs এগুলোও কম sudden onset of cough, respiratory distress and wheeze. হ্যাঁ ওইটা মুখস্থ করা একটু কঠিন। Physical examination, symptoms, cough, respiratory distress and wheeze. Physical examination, dyspneic flare of the ala of the nose, cyanosis, head nodding, occasional grunting, and examination of the chest, inspection, palpation, percussion, and auscultation. Inspection shows fast breathing, chest in drawing, then suprasternal recession, hyperinflation. Percussion shows hyper resonant, auscultation shows breath sound is vesicular with prolonged expiration. Widespread bronchi, sometimes fine crackles. Saturation percentage of oxygen very low. Investigation, number 1, X-ray. The characteristics findings are hypertranslucency, more blackish lung field, then hyperinflation, horizontal ribs, depression of the domes of diaphragm, Number 2, blood, complete blood count. Treatment of bronchiolitis, counseling the parents about the disease, counseling to mild case, and number 3, in severe case. Mid case, home care, head up position, normal feeding, cleaning nose with normal saline drop, breathing with lukewarm water. Referral knowledge in severe case. Severe case, hospitalization. Humidified oxygen therapy. Keep the baby NPO and appropriate IV, nebulized with hypertonic saline, monitoring, ventilator support, supportive management, nebulization with salbutamol, and others treatment. Hospitalization, indications of hospitalizations: central cyanosis, not able to drink, restlessness, severe chest in drawing, grunting. Humidified oxygen therapy, 4 to 6 liter per minute. Humidified oxygen therapy 4 to 6 liter per minute. Keep the baby NPO and appropriate IV fluid. Nebulized with hypertonic saline. That means 3% sodium chloride. Then monitoring, particularly the saturation percentage of oxygen by pulse oximetry, ventilator support when severe respiratory distress. Supportive management as in home care, nebulization with salbutamol. Others treatment, steroids and antibiotic. Steroid, parenteral dexamethasone may be tried only in severe cases. Parenteral dexamethasone. Antibiotics usually no role. Acute bronchiolitis, it is a severe infection. It is an acute viral infection of the bronchioles and is characterized by cough, respiratory distress and wheeze that start following an episode of upper respiratory cataract. Clinical features of bronchiolitis. Clinical features: sudden onset of cough, respiratory distress and wheeze. Physical examination: dyspneic, flare of the allowed nose, cyanosis, head nodding, occasional grunting. Then chest examination: inspection shows fast breathing, cyst indrawing, suprasternal recession and hyperinflation. Percussion shows hyper-resonant. Auscultation: breath sound is vesicular with prolonged expiration. Widespread bronchi, sometimes fine crackles. Saturation percentage of oxygen is usually low. Investigations: X-ray, chest and blood. The characteristic findings are hypertranslucency, molar blackish lung field, hyperinflation, horizontal ribs, depression of the domes of diaphragm. Complete blood count unremarkable. Treatment: counseling the patient about the disease, mild case, home care, head up position, normal feeding, cleaning nose with normal saline drop, breathing with leak or mortar. Referral knowledge in severe case, hospitalization. Indication: central cyanosis, not able to drink, restlessness and severe chest indrawing. Grunting. Humidified oxygen therapy 4 to 6 liter per minute. Keep the baby in NPO and appropriate IV fluid. Nebulized with hypertonic saline, 3% sodium chloride. Monitoring, particularly saturation percentage of oxygen by pulse oximetry, ventilator support when severe respiratory distress, supportive management as in home care, nebulization with salbutamol. Other treatments: Steroids, parenteral dexamethasone may be tried only in severe case. Dexamethasone in severe case. Antibiotics usually no role.